Hello beautiful people, welcome back to my video again. I'm Sahar Rashid and today I want to present before you a bizarre case. Recently there was a competition on about that participants has to drink as much water as they can. So a lot of people participated in this competition. Among these participants there was also a 27 years old lady. She drank 7 liters of water without paying it off in the 3 years of time duration. And luckily she won this competition. When this participant went home back, she started feeling some minor symptoms of like headache, nausea, vomiting, confused, lethargic and etc. But she didn't pay much attention to these symptoms. Unfortunately, next day she was found dead at the home. So, why she died suddenly? What was the reason behind her death? A 27 years old, otherwise healthy lady who just took few liters of water and found sudden death. Let's disclose this case and let's try to know what was the cause of death, starting with the pathophysiology. Guys, you know that our body has got a lot of electrolytes and minerals. These electrolytes has the function to keep our body in a physiological state or in a homeostatic state. And these electrolytes in our body are in a fixed concentration. That means if they fluctuate in the concentration, either higher level or below the normal level, this can have consequences or lethal effects on our body. Among these electrolytes, let's talk one of the most important electrolyte, the sodium electrolyte. This sodium has got a lot of physiological and vital functions in our body. For example, if I count some of you, is like the sodium is help in nerve conduction in our body, nerve impulse conduction, muscle contractions in our body. This has effect on the maintaining the blood pressure in our body, and also to keep a check on the fluid status of the body. This sodium is vital. And our most important cardiovascular system, like contraction of the heart, maintaining the cardiac output, blood pressure, it's all because of the sodium and other electrolytes. So this lady has taken 7 liters of water, which is definitely an excess amount. So when this lady took 7 liters of water, that water reached her small intestine and got absorbed, and finally it reached the blood circulation and blood got diluted. And as a result, concentration of the sodium per se decreased. One more fact is that in our body, when we pee off, it's not only the water comes out of the body, along with this water there comes sodium out. When this lady peed, there was further loss of sodium with the urine, so further decrease in the sodium concentration. This loss of sodium electrolyte has some vital and harmful effects on our body. Normally what happens when there is volume overload in our body, that is increase in the water in our body, the body tries to distribute this water by any means. So the cells are responsible for that. That means the cells take up the excess water, they absorb this water, and these cells get swallowed up. And it is normal to some extent. But if this absorption takes place in the brain, or as like, that is, if the brain cells take this or absorb this water, these brain cells will swell up. But the problem is that our brain is in a fixed cavity of the cranium. That means it cannot expand further from this. So as the brain swells up, increases in the size, it starts compressing the cranium. In the medical system, that's called as the ICP, or intracranial pressure increase. Also, our brain has only one major opening, that's called as a foramen magnum. So when this brain swells up, it comes out of this foramen magnum and compresses the brainstem. So our brainstem has got many vital and functional centers. For example, cardiovascular center, respiratory center, center for the consciousness, awareness, and etc. So in this lady, when the brain increases in size, swells up, it gets herniated via this foramen magnum and compresses the brainstem, so compromising these vital functions. For example, there is respiratory distress or decrease in the respiratory center. As a result, patient can have the acute respiratory distress or even respiratory arrest can be there. And if sometimes it affects the cardiovascular system, resulting in the sudden cardiac death or collapse. And the patient can get loss of consciousness, syncope can be there, and all these factors, if predisposes, the patient can die at sudden. That's probably the cause of this lady as she died suddenly. So this is how this lady died. This case is bizarre and scary, but my motive is not to scare you, and my message is not to tell you that you don't need to drink water at all. I mean to say, we need to have the water in a proper quantity. That means as per the requirements of your body. For example, normally if you say that how much water you should drink daily is not more than 3 liters. And also it depends on the some other factors. For example, in which conditions you are living. Is there the environment humid, or you are having the profuse sweating, you're getting dehydrated, or you're having any associated comorbidity or any disease you are having. So all these factors have the different requirements. But in a normal healthy individual, if I say normally a healthy individual should have 2 or 3 liters of water per day, that's it, not more than that. And there is a famous quote that excess of everything is bad. That definitely fits. So this was all about today's that water can be even harmful to you. So don't run behind the myth that drinking more water makes you beautiful and cleans your blood and blah blah. That's not going to work. Have this habit of having a proper quantity of water, and stay healthy, stay hydrated, live your life ahead. I will meet you in the next video with some more information. Until that, take care. Allah Hafiz.